Sometimes I get very interesting offers from patients. For example, the patient says, I want to have this filling done. I say, okay, let's do it. The patient says, I have the filling, I bought it. Can I just pay you the fee to inject it? You see, there are even some who inject their own filling. Then they experience problems and run from doctor to doctor. These products, fillers, botox, and the like are approved and permitted products in the practice of medical specialists. They cannot interfere with problems that might come up with you. Use them on your own. It is not right to use these products on your own or buy them and call a doctor to inject them in. Indeed, we used to see some very absurd events. The patient calls me and asks, how much for Botox? I say this much. But she says, I already have Botox. How much if I brought it on my back? I say, ma'am, is your Botox in your bag? She says, yes. I ask, where you get it from? She says, I bought it in the pharmacy last week. I say, has it been in your bag for a week? They say, yeah. Well, products like Botox have to be distributed and kept in cold storage. The patient somehow bought it at the pharmacy and put it in her bag. Let me tell you one thing. Within 2 to 3 hours, Botox has already become unusable. Because when it's hot, the Botox goes into the pot. The patient says walking around for a week in it, for a week with it in her bag, looking for a doctor to inject it. Nonsense. For instance, I was in Zonguldak before. The company first asked for my diploma to send the Botox to me to Zonguldak. I sent a copy of my diploma to the company. After I gave them proof that I'm a doctor, an expert in this business, they sent me the Botox in a special box in a dry ice. And they enclosed a note like this. Call us as soon as you get the Botox. Was it in ice inside the box? In other words, did I get your home in a cold storage? When I opened the box, I saw the note inside. I called the company. I got the Botox. The ice is solid. I told the company that it arrived before the ice melted and safely in cold storage. Now the patient says, I threw it in my bag. I walked around it for a week. Please don't be doing those stupid things like that. Don't use these products on your own. There are so many patients like this. She says, I put my own filling here and there. For God's sake, where did you get that? She found it somewhere. Actually, it is currently banned. Pharmacies don't sell these products. They only sell them to the medical specialists. Medical specialists who are registered with the Chamber of Physicians and have been working with a license and a diploma. Please don't try to get them injected by just anyone you find here and there who claim to be giving these injections. If this was as simple as it seems, they would be sold everywhere. Please don't gamble with your own health. Let me give a few warnings about the filler Botox. For example, like what? Less filler. Patients say, my lower lip is thick enough. I want a little less for my upper lip. Half syringe. Can you do a discount like that? Well, first of all, I was not able to please any patient on whom I used this method. The patient comes back later and says that it is too little, because there's no such thing as a less filler. Companies have been making these fillers for many years and have determined their volume as 1 cc. 1 cc of filler is enough for the upper and lower lip. And it should be done in such a way that you need to divide it between the upper and the lower lip. You can't get a result if you only do half. For instance, once a lady came to me with her daughter, they said, let's try it. Make half for my daughter and half for me. So we'll do a half cc for mother and the other half for the daughter. And we'll use a quarter cc for the upper lip and a quarter cc for the lower lip. Even though I insisted, said that it wouldn't work like that, they made me do it. And they came back after 2 weeks, said it no effect at all, and so on. This is willful ignorance. I'm telling you. With half of a syringe of filler, you cannot do the upper lip or anything else. You open up 1 cc injector, half is used for the upper lip, the rest for the lower lip, and you get a good result. That's it. Please don't ask for less filler or anything like that. If you go beyond the normal application, you would face problems. And what is done with Botox? The patient come to us, I want to have a Botox. Okay, Botox is done on a lot of people, all right, but there are also people whom Botox is not right. For example, one day a lady came in, eyebrows raised, no wrinkles, marble-like skin. There are no wrinkles on the side of the eye, nor between the two eyebrows. In other words, she can have a proper facial expression. I said to her, Botox will have no effect on her. The woman broke down, oh well, my friends do it, why can't I do it? Why will it have no effect on me? And such things and attitudes accusing the doctor. Insulting. Why won't it work on me? How would you know? I said, okay, fine, let's do it. Then we did it after 2 weeks. The lady came back and it said that it didn't affect on her. And I said, what does Botox do? It opens wrinkles, lifts eyebrows, corrects crow's feet at the edge of the eye. So, if you don't have them, Botox won't be effective, period. Botox is a medicine, a drug. Going to the doctor and asking for Botox is like going to the heart doctor and asking to take that heart medicine. The patient should come to us like that. A patient should and say to me, I have a complaint. Complain first. She should say like this, I have wrinkles between my two eyebrows. I have wrinkles at the edge of my eyes. If she comes and says that, then I say that the solution is Botox and we get it done. That's the right thing to do. But unfortunately, maybe it's because of the media filling people's heads. What can I say? This has become a little degenerated. The process of coming in with a complaint, then determining the treatment and applying the drug, that process is gone now. The patient comes and says, I want Botox. When they tell you that it cannot be done, you ask, why not? Please don't do that. Botox is a medicine. Is it suitable for you? Will it be useful? Please leave that to the doctor. You can ask for Botox. If it's suitable for you, the doctor will know. That's it. But first, state your complaint. The normal doctor-patient relationship should be like this. The patient should come and tell us about their complaint. Maybe I'll recommend you something more effective than Botox. Perhaps there is more appropriate treatment that can be used. You have to first describe your complaints so that we can recommend what instrument, what drug we have, what treatment is possible. That's the right way. But unfortunately, let's say the media has pumped up these patients. This normal doctor-patient relationship has shifted. First complaint, then we will determine what can be done. Then the necessary treatment and medication, surgery, whatever. Let me warn you in this regard. If there's any issue that you can't find an answer here, or if there's any other issue that you want to ask, you can ask me a question using the numbers there via WhatsApp or email. My only request when you email or ask questions, if your question is a visual issue, please send me a photo of the problematic area that your issue concerns. For example, if you ask something like a scar repair or whatever, I can get results from the surgery. Be sure to send a photo. I cannot answer if you don't send me a photo. Also, be patient while you wait for answers because there are many questions. I try to answer all of them as much as possible. Please try to write your email address correctly. If the email address is misspelled, I will not be able to reach the patient. Thank you very much for your interest.